So in the counselling role, you support the person in front of you. I am a supportive person, and my role would entail supporting the family through their critical care journey. These families come in with sometimes nothing. We support them in every aspect, support the emotional support, physical support, spiritual support, and supporting with finances. Parents are basically in two. They're trying to sustain family life, but also trying to sustain the journey for the child. There are an awful lot of children who don't survive in intensive care, and that can be heartbreaking for us as a team, as well as obviously the family. One case comes to mind where parents lost their child in a road traffic accident and donated their child's organs, and it was an extremely emotive decision that they made. And that mum actually has supported the charity since that. We would have good links with her, and she's wanting to help support the journey for other families. Yes, it's really rewarding from that perspective. The families do connect with intensive care a lot. They never forget the journey, even if it is very difficult. They never forget the journey.
So we have 12 intensive care beds which provide critical care to children across Northern Ireland. We are the only intensive care for children in Northern Ireland, so any patient who requires critical care and paediatric input will come to us. So our patient vary from newborns from first day of life up to 15, 16-year-olds with a multitude of reasons to be with us, I suppose. What is critical care? It's a patient that's requiring support, usually for an organ system. So they might need help with their breathing, they might need help with their blood pressure, their heart rate, they might have problems with an infection somewhere that we're needing to support them through. Patients who require filtration, so patients whose kidneys aren't working for some reason, or patients with poisonings, for example. It can be an acute sudden event, so we have patients who are admitted following traumatic incidents, so involving car accidents and collisions. We have patients who are admitted following strokes, who are absolutely well, and then suddenly in intensive care requiring full support. We have additional staffing here, so we can look after the patients more intensively than can be looked after and managed at ward level. So our nurses, we work one-to-one with our patients. Our intensive care patients will always have at least one nurse at the bedside 24 hours a day. We also have to kind of look after the family as part of that process. So we have an open visiting policy, so the families are encouraged to stay as much as possible with their child, which is beneficial to them, beneficial to the family, and beneficial to the patient. I think the reason this place works, and the reason is the care that's given. So I think we do, as far as possible, look after every patient as if they were our own child. So you do get very emotionally invested. You do you do come to know the families very well. The nursing team who are at the bedside 12 hours a day are, as I say, walking hand in hand with the family and trying to do an incredibly complicated job whilst also look after the family. It's a tremendous juggling act that they do, and they do it with great skill, great love, and phenomenal dedication. We know we work within a financially tight system, and there are often things that we need in terms of equipment or things that we need in terms of training and time. A lot of our training in terms of going to get training or going to courses and conferences is not going to be delivered locally, so we do need support to be able to get the entire multidisciplinary team to the right venue, to be able to get the right training, to be able to deliver it to the patients that we look after here. Working within a financially kind of difficult situation, obviously. We're aware that money is limited, but this enables us to access the charity, to use money to get staff away to courses and conferences and to support them, and then to be able to support the families as well in the times. This is probably the worst thing, or one of the worst things that can happen to you as a parent, is to come and see us. So anything we can do as a group to make it easier for the families will help. And the thought that your children are going to be here at such a and critically unwell, requiring such round-the-clock care and support. I think to know that the people who are looking after them have the right skills, the right training, the right equipment to do that. To know that there's somebody else there also looking after you at that time. So basic things, we are always encouraging our families to make sure they get something to eat, get somewhere to sleep, get some rest. You're trying to process what is the worst thing that could happen to you and deal with it at a time of heightened emotional stress and anxiety.
The Little Heroes charity would be life-saving for most families. If you can imagine, you have to down tools. These parents can't work. A lot of them are self-employed, and they've maybe no income for a good few months. The financial side of it has to take a second step for them. So, you know, like we can just do so much with Little Heroes charity to help these families. Because at the end of the day, these families sit here day after day watching their child, sometimes maybe getting better and sometimes not. They skip everything just to be at the bedside. And we feel very privileged as staff to be there for these families, but they need us.